Perioperative nursing is a nursing specialty that focuses on patient care throughout the surgical journey, from pre- to post-operation. As a profession, perioperative nursing is pivotal in managing the entire surgical process to ensure patients receive safe, quality care. An understanding of the professional environment or infrastructure is fundamental for everyone in the field, from newly graduated nurses to seasoned perioperative nursing professionals. So what are the elements of the perioperative nursing infrastructure as a profession? Let's start with what a profession is. A profession is often described as a paid occupation that involves prolonged training and formal qualifications, has established ethical standards, and provides a direct service to the public. Perioperative nursing fits the definition of a profession. Each component of the perioperative nursing infrastructure has an established role that supports the profession. Key components of a professional infrastructure include membership organizations, certification bodies, regulatory agencies, education and training programs, and other supporting organizations. Now that we know the basic infrastructure components, let's break down each piece. Membership organizations. Membership organizations are groups that provide a platform for perioperative nurses and organizations to connect, collaborate, and share their passion for this specialized field. They are motivated by supporting and growing their member bases, and achieve this by providing a wealth of beneficial resources and activities, including continuing education through workshops, conferences, and online learning to keep nurses current on best practices and emerging technologies. Advocacy, by providing representation at the national level to shape policy and promote the value of perioperative nursing. And networking, through opportunities to connect with colleagues, encourage collaboration and knowledge exchange. The Association of Perioperative Registered Nurses, AORN, is the primary membership body in the perioperative nursing profession. It is an organization that defines, supports, and advocates for patient and staff safety through exemplary practice in all phases of perioperative nursing care, using evidence-based guidelines, continuing education, and clinical practice resources. It develops the perioperative nursing scope and standards of practice and the guidelines for perioperative practice. These guidelines represent best practices for the profession. Adhering to the guidelines is not required, but it is recommended. There are other professional organizations that support the work of perioperative nursing at the state and local levels in the U.S. and internationally. Certification bodies. Certification bodies evaluate perioperative nurses' knowledge, skills, and abilities to develop and administer voluntary credentials. The evaluation criteria reflect the highest standards within the profession and serve as a community benchmark for testing safe patient care and knowledge that a perioperative nurse implements in and out of the operating room. In perioperative nursing, the certification body has three general functions. 1. To develop certifications that ensure ongoing relevance by reflecting the ever-evolving landscape of the perioperative nursing occupation. 2. To validate skill sets within the perioperative profession. And 3. To provide ongoing professional development opportunities that allow certificants to leverage their credibility for career progression. The Competency and Credentialing Institute, CCI, is the primary certification body in perioperative nursing. CCI validates the competencies of perioperative nurses in varying career stages and subspecialties through certification programs, specialty designations, and professional development resources. CCI strives to promote continuous professional development and lifelong learning that drives safe, quality patient care. Regulatory agencies. Regulatory agencies play a crucial role in the perioperative nursing infrastructure by maintaining professional practice standards and policies for nurses and others within the profession. These governing agencies control and determine regulatory requirements related to the scope of practice, ethical patient care guidelines, and the accreditation of educational or professional development programs in the perioperative space. The Centers for Medicaid and Medicare Services, CMS, the Occupational Safety and Health Administration, OSHA, the Joint Commission, and the American Nurses Association, ANA, are vital regulatory bodies within the profession. While CMS, OSHA, and the Joint Commission develop regulatory and accreditation requirements for nursing and other healthcare-oriented professions, ANA establishes the ethical standards for the nursing profession. Additionally, AORN expands on the ANA Code of Ethics to provide specific examples applicable to the profession of perioperative nursing. State boards of nursing are also another layer of regulatory oversight to ensure safe and effective patient care. These statewide regulatory bodies set requirements for nurses practicing within their state, including initial licensure and maintenance requirements. Education and training programs, continuous learning and skill development are essential for perioperative nurses due to the field's ever-evolving nature. Although there is no standardized training program for perioperative nurses, many organizations offer specialized training and development programs to help nurses gain and improve their skills and stay up to date with best practices. These programs can take many forms such as workshops, micro-credentials, certificate of mastery courses, degree or certification programs, and hospital-based orientation programs. Other organizations such as news outlets and journals serve as vital communication channels within the perioperative nursing space. These resources provide the community with the latest research, changes to best practices, industry updates, and professional development opportunities. Journals publish research findings to inform best practice adoption and guide clinical decision-making in the operating room. News outlets report on industry trends, innovations, and success stories, fostering a sense of community and shared experiences among perioperative nurses. The organizations, agencies, and programs reviewed are the foundation of the perioperative nursing profession. Now that you understand our profession's infrastructure, what can you do with this information? You should become a member of the national or local membership organization to build a community of peers and mentors to support you throughout your career. Your membership is essential for these organizations. As a perioperative nurse, you have an obligation to remain informed about the changes in regulatory requirements, RN license maintenance, and updates to practice scope and standards for perioperative nurses. If you hold a CCI certification, it's crucial to remain informed about credential updates and the process for recertification. CCI credentialing associates are available to assist with questions and help resolve issues related to your certification. The entities operating within the perioperative nursing infrastructure are here to support you throughout your career and help you achieve all your professional goals.